Hi guys, we're doing an amazing immersion CSA course in Manchester, about to get on the road now to Birmingham. I thought I'd do a really quick video on open and closed questions, what they're all about, how to get the most out of them, and how to get value out of them, and how to balance the two up in your consultation, whether it's things like CSA, PLAB 2, GP Stage 3, we get asked this kind of stuff a lot. So, what's the key difference? Let's start with the closed questions. In a closed question, I'm looking for a very short, sharp, succinct piece of information. I want to get through a lot of information in a very quick period of time, and I'm looking for things like yes or no answers. Now, one thing that's really important about closed questions is the signal that leads up to the question. If you just say, have you got any, weight loss, or have you got any blood in the cough? Now, we're expecting a yes-no answer, but the role player may start to elaborate. Well, last year I had a bit of this, then I did some exercise and I lost a bit of weight, I'm not really sure. So you've asked a closed question, but you've not got a closed answer, so it can take a lot of time away. So it's the signal that's so important, the signpost that's coming first. Mr. X, when it comes to a cough, there are a few key questions that we need to ask about. So I'm just going to ask you a couple of yes-no questions if that's okay. Now that's a signal that I'm looking for a very quick, short, sharp answer, yes or no. But if you don't put that signal in, the risk is that you ask a closed question, but the answer that you get is very, very elaborative. Now with an open question, you're looking for the opposite. You're looking for an elaborate answer. You're looking for someone to keep coming with thoughts and ideas and expand on thought, because the beauty of an open question is that it might give you information that you hadn't even thought about in the first place. So you're not after short, sharp answers. You're after thinking, you're after development of an answer. Now, the most important thing, this can happen in ICE, for example, when you ask about someone's mind, ideas, concerns, expectations, I want them to elaborate. I want them to keep going. I want to understand what's going on in their mind, and that can take a little bit of time. So you ask the question, Mrs. Section, you've had these symptoms for a while now. What were your thoughts about all of this? Tell me. Or you've had these kind of symptoms for a while. Was there any particular worries that were going on about all of this? These are open questions, but the key with an open question is it's not just the question that keeps the answer coming. It's the ongoing encouragement of the answer that keeps that open question working. So they may give you a first line, but it's active nodding, it's listening, it's hand movements, it's showing that I've got genuine interest that will keep the answer rolling. Because remember, in an open question, the answer you're looking for may not be in the first statement, maybe the second or third or fourth statement, but you have to keep encouraging that contribution, and that's the key to get full value out of an open question. Now, with a closed question, the most important thing, just to recap, is the signal. It's the signal that I'm looking for a really short, sharp answer, so that you get really short, sharp answers and you get a lot of information in a quick period of time. For example, red flags. Whereas with an open question, the most important thing is the ongoing encouragement to keep the answer coming. Tell me more, tell me more, tell me more, so you get full value out of that particular answer. For example, when you're doing things like ICE. So it's really important to practice open and closed questions. Don't worry about when should come first, when should come second, because every patient's different, every situation's different. You've got to rely on your gut feeling to know when these things are appropriate. But when you do a closed question, signal it first. Make sure you get a closed answer. You explain that's what you're looking for. When you're doing an open question, focus on the ongoing contribution to get full value from that open-ended question. There are much more like this at our immersion CSA courses, our immersion PLAB 2 courses, our immersion GP Stage 3 courses. So have a look at the website aroramedicaleducation.co.uk and book yourself on one of those dates. Hope this helps. Hashtag can pass will pass. Hashtag I went with Arora. Good night.